my second video about my life experience in fighting a dreaded disease called lupus. And as I mentioned on my first video, I was diagnosed of lupus since October 2010. How? My nephro referred me to a rheumatologist. She's the one specialized in diagnosis and treatment of arthritis and other diseases of the joints, muscles, and bones. So I went for consultation. During our conversation, she asked me to describe what I felt for the past weeks. So I told her that mostly I suffered from fatigue, joint pains, sometimes shortness of breath, and mostly headache. Because of that, she requested me some series of tests such as CBC, or the complete blood count, the creatinine for the kidney, SGPT, SGOT for the liver, ESR means the erythrocyte sedimentation rate. It measures the degree of inflammation present in the body. Normally, red blood cells settle slowly, but if it is faster than the normal rate, it may have inflammation in the body. And the latest test is the ANA. ANA test means antinuclear antibodies. Anti-nuclear antibodies. If you have ANA in your blood, it means you have an autoimmune disorder. So when I get the results of the test, I immediately went back to my room. The result indicates that I am positive with the ANA, which confirmed that I have lupus, and also my ESR results is very high, means I have inflammation in my body. I was so sad and depressed at the time, but Dr. Penserga, my rheumatologist, is very kind to explain to me how to manage it. You know guys, lupus is a chronic disease with no cure. This means that you can only manage it with treatment, but it will not go away. Sad but true. Treatment only improves symptoms and prevent flares and other health problems that cause lupus. The first thing that what my doctor did was to prescribe me medicines like prednisone, used to treat conditions such as arthritis and immune disorders. It works on the immune system to help relieve the swelling, redness, and allergic reactions. Prednisone is a drug known as steroid, and also plaquenil. It is a medication known as a modifying anti-rheumatic drugs that can reduce skin problems in lupus and prevent swelling pain in arthritis. And if I experience headache, I can only take paracetamol like Biogesic. So that's the first treatment. I had losartan for my high blood, which was given by my nephro, and the prednisone plaquenil by my rheumatologist. I started prednisone 40 mg. Yes, it's super high because I have inflammation. My lupus is very active on that time. Every month, I have to come back to my doctor for management, and of course with series of blood tests every time I had a follow-up. Because that's her basis if my lupus is improving with the oral meds that I'm taking. I asked my I asked my doctor how did I get this. Sabi niya, it may result from a combination of genetics and environment. It appears that if ever na naka-inherit ako nito, then I come in contact with something in the environment na nakapag-trigger ng lupus. Or maybe stress daw. Kaya iwas sa stress, guys. So after 3 to 4 months of medication and monthly laboratory tests and follow-up with my lupus doctor, she told me that I need to undergo chemotherapy. Yes, guys, chemotherapy. I thought it was only recommended for cancer patients, but unfortunately, it was recommended by my doctor. I felt so upset asking why I have to undergo such treatment. But only professionals know what best for their patients. So if that's the case, I need to abide. The problem is financial sorting of everything. Where will I get the fund for my chemotherapy? I'm the only one working, and I had a daughter that is only 11 years old, so I'm depressed that time. But my husband is very supportive to me. He always told me that God is in control of everything. He even told me, wala siyang ibibigay sa'yo na hindi mo kaya. Tama, diba? Just trust in Him. So I decided to talk to my doctor for the details. But before I went to her, I talked and prayed to God first. I told him, ikaw nang bahala, Lord. You know my situation. So the next clinic schedule, I went back to my lupus doctor and talked to her about my chemotherapy. What might be the side effects, and of course, how much do I need to prepare, and told her that I'm short in funds. But you know guys, God is good. Because my doctor did not ask for a high professional fee. And she told me that I will not be admitted to hospital during my medication regimen. Instead, she will do the chemo session on their department office para wala nang bayaran sa room. Diba? God is good. So there it is. I undergone chemotherapy for 5 consecutive months. Pero it should be 6 months. Kaya lang, I told her hindi ko na kaya kasi nahihirapan ako. And asked her if there's other alternative for chemo. Because my chemotherapy is okay for me on the first day. On the first chemo, okay naman. Walang masyadong side effects na nararamdaman. Pero pagdating ng second chemo ko, there comes out the side effects. Pag-uwi ko ng bahay, I felt so dizzy. I always vomit. Sobrang hirap pala. Hilong-hilo ako, tapos sumasakit yung tiyan ko. Walang tigil ang suka ko, kaya sobrang sakit kasi wala ka naman mailabas. Grabe. Tapos yung pinakamasaklap nun is nung nagsuklay ako tapos pagtingin ko sa suklay, yung isang bungkos ng hair ko sumama lahat doon. Then when I look back at my head, I saw part na sinuklay ko na napanot na kalbo. And every time I comb my hair, sumasama na lahat ng buhok. Takot ako doon. Yun yung time na napahagulgol ako talaga ng iyak. So, ang ending, depressed na naman ako. But life has to go on kahit feeling mo napakamalas mo ng tao kasi sa dami ng magkakaroon ng ganitong klaseng sakit, kasama pa sa nabunot yung pangalan ko. I need to work pa din every day. Kasi when I'm at work, nakakalimutan ko may sakit ako. Sometimes, it's so hard to walk up in bed para pumasok, lalo kakatapos lang ng chemo. Pero kinakaya ko yun. Pasok pa din ako. Mahirap kasi mag-absent. Sa klase ng work ko, wala akong kapalitan. So fight lang, bahala na si Lord. Basta pray lang for guidance and strength. Pero maraming changes pagpasok. Kailangan ko I have to wear mask kasi very prone ako sa sickness. Madali akong mahawa kasi sobrang hina ng immune system ko. Kasi naka-prednisone ako eh. When it comes to household chores, hindi ko na din kaya maglaba, maglinis ng bahay, kasi madali na ako mapagod. Tapos sumasakit pa yung mga buto ko. So I leave all that to my husband. So after ng chemo, medyo nanahimik ang lupus ko. Nawala ang player, basta continuous lang ang meds. Sabi ng doktor, tulog ang lupus ko. Pero ang effect sa akin ng mga gamot ko, lalo na yung prednisone, nagkaroon ako ng malaking mukha, moon face. At syempre, nakalbo din ako. Pero okay lang yun. Pumangit ka basta buhay ka pa. Since tulog daw ang lupus ko, need ko naman daw bumalik sa nepro ko para malaman yung lagay ng kidney ko. Kasi I always had a high results of creatinine. So my nepro told me that I had to undergo kidney biopsy. A medical procedure in which a small piece of kidney is removed from the body for examination. Usually under a microscope. It can provide information needed to diagnose, monitor, or treat problems of the kidney. But before biopsy, need to undergo kidney ultrasound first for a diagnostic exam that produces images which are used to assess the size and shape and location of the kidneys. So, kailangan muna yun para malaman kung saan sila tutusok ng malaking karayom. So, when they got the result of my ultrasound, they do the procedure immediately. It is very painful for a few hours, but you have to take a rest for 3 days and avoid strenuous activities because it might bleed. So, tsaka sobrang gastos, diba? My doctor told me that my kidneys are affected by Lupus na kailangan daw alagaan and proper medications. So, ganun muna siya. Follow up lang sa mga doctor and inom ng gamot since tulog naman yung lupus ko. I changed my nepro doctor na mas malapit na dun sa work ko. Kasi masyadong malayo yung unang nepro ko sa Philippine Heart Center and on-work sa Manila Doctors. So, kumuha ako ng nepro na doon na rin sa Manila Doctors. She's one of the best doctors sa Manila Doctor Hospital, si Dr. Montemayor. Sa kanya na ako nagpa-follow up. Siya ay nag-aalaga ng kidneys ko. But after some time, siguro dahil wala na ako nararamdaman, okay naman din yung lupus ko, hindi na din active, nawala na sa isip ko ang check-up at medyo na-busy na rin ako sa work. So in short, napabayaan ko muna. Hindi ko na-monitor yung kidney and yung lupus ko that time. So year 2016, nang may naramdaman na naman akong hindi maganda sa katawan ko kasi sumasakit na naman yung balakang ko. Kaya I decided to do some lab tests like creatinine, the CBC, 24-hour urine protein, before I go to my nephrologist. Sabi niya, need ko daw ulit sabi ng nepro ko, nang makita niya yung result ng mga lab test ko, I need to undergo a kidney biopsy na naman for the second time. Hindi ko na alam kung saan ako kukuha ng funds para sa another procedure. Imagine, 60,000 na naman ang cost ng kidney biopsy. Nakakaloka. But God is good. He provides. Marami siyang mga taong ginamit para maging instrumento. Bumuhos ang pagpapala sa akin ng mga time na yon. Kahit classmate ko nga na hindi ko naisip na tutulong, sa akin nagbigay. Relatives and friends ko din na nag-share ng blessings nila sa akin, kaya sobrang thankful ako sa kanila at syempre kay God. Truly, God works in mysterious ways. Na-raise ko yung funds for my kidney biopsy for the second time. So again, I was admitted at the National Kidney Institute for 3 days for my kidney biopsy. The diagnosis of my kidney biopsy result was immune complex mediated glomerulonephritis with 4% crescents. Considered to have IgA nephropathy. Glomerulonephritis is a group of diseases that injure the part of the kidney that filters blood. When the kidney is injured, it cannot get rid of waste and extra fluid in the body. That may result to kidney failure if the illness continues. I have a chronic kidney disease. Lupus affects my kidneys. If I'm not mistaken, 65% of my left kidney is damaged and 50% sa right. So, need na talaga siyang alagaan para hindi na mauwi sa dialysis. Need to control din talaga may lupus para hindi na niya tuluyang sirain ang mga kidneys ko. So, I should know how to tell when the flare is coming. I should see the doctors regularly. Mag-reduce ng stress, limit sa mga sa sun, under the sun, hindi ako pwedeng naaarawan. I need to eat healthy foods such as fruits, hindi processed foods. Get enough sleep. These are all the things that I should do to control my lupus. Although I know all these things, alam ko naman lahat ng bagay na yan, pero syempre hindi ko din yan lahat nasusunod. When you're working, of course, you're under stress. At makakain mo lang naman kung anong available na tinda. Hindi mo din makukuha yung enough rest kasi need mo gumising ng maaga dahil papasok ka. Madadaan ka din sa init ng araw at syempre hindi ka makakapag-follow up ng madala sa doktor mo dahil nga busy ka din sa work. So to make the story short, after how many months na walang follow-up sa doktor, what do I expect? So on the year 2017, eto na naman. Meron na naman akong nararamdamang maganda sa katawan ko, kaya naisipan ko na naman po magpa-check up. I brought my lab test to my nephrologist, which is again creatinine, the 24-hour protein test, and so, etc., etc. But the result of my 24-hour urine protein is very high. You know guys, the normal is only 150 mm. of protein per day. But my result is almost 3,800. Sobrang taas, grabe, 'di ba? From 150 ang nakuha ko, 3,800. So, ibig sabihin, maraming protein level sa ihi ko na nagsisignify ng kidney damage. So, that day, sabi ng doktor ko, need ko na daw agad magpa-admit, emergency, sa hospital para sa procedure na gagawin nila sa akin for 3 days. Nakakaloka, diba? Di na ako umuwi ng bahay after work. Diretso na ako nagpa-admit ng hospital. Tinawagan ko na lang yung husband ko na sabi ko nga, magpapa-admit na ako sa hospital kasi emergency. I need to undergo steroid infusion of 1 gram of intravenous methylprednisolone daily for 3 days. It is a liquid steroid that is slowly drip into your vein through a thin tube. Grabe, diba? Naka-steroid ako ng 1,000 milligrams for 3 days. Para akong groge dahil sa taas ng steroid ko. Need ko din turukan ng insulin kasi tumataas ang sugar ko dahil sa effect ng steroids. Grabe din yung monitoring sa akin ng mga doctors and nurses kasi nga sa possible effect sa akin nung ginawang shock. But thanks God kasi na-survive ko yung steroid na yun. So after 3 days, na-discharge na ako sa hospital. So I need to continue my meds and follow-ups. Dami kong meds for maintenance, grabe. Celsep, 500 mg 3 times a day, which costs 110 pesos each. Imagine, sa Celsep pa lang 300 plus na ako per day. Prednisone na 50 mg once a day, another 30 pesos. Aprobel for high blood twice a day, 50 pesos each. Caltrate for my bones and Atenorix also. Sabi ko, how will I survive sa mahal na mga gamot ko? Paano ko itong mabibili lahat? Kaya kahit na nahihirapan, need ko pa rin mag-work. Fight lang! God is with me. Alam ko hindi niya ako papabayaan. Pero para mainom ko lahat ng meds ko, lumalapit naman ako sa mga politiko para humingi ng medical assistance sa kanila. Basta complete lang yung requirements mo, mabibigyan ka naman nila ng guarantee letter na ipagpapalit mo sa mga government hospital para maging medicine. So, ganun, nakaraos ako ng ganun. Follow up lang sa mga doctors para sa mga meds ko, okay na. Nagka-problema rin ako sa heart. Nagpa-palpitate kasi lagi, so I need to check up naman sa cardiologist. Binigyan niya rin ako ng gamot, so dagdag na naman yung carvedilol tsaka atorvastatin. So yun yung mga gamot ko na mini-maintain until now. But sadly, when pandemic started, nawala na ako ng work. Kaya problema ko ngayon, yung mga maintenance meds ko. Di na rin ako nakakapunta sa mga hospital for follow-ups kasi mahirap nga dahil maraming mga infected, mahirap baka mahawa ako. Pero I know God will provide everything. Hindi niya ako pababayaan. But you know guys, while I'm recording this video, I'm not feeling well. I don't know kung nag-active na naman ba yung lupus ko o baka stress lang ako sa buong quarantine. Dahil sa biglang pagkakawala ng work. Kaya medyo sumasakit ulit yung mga bones ko at sometimes ang hirap kong makahinga, nahihirapan akong huminga. Pero sana hindi naman. Kaya need ko lang talaga pahinga lang. I just finished my laboratory test yesterday and waiting for the results. Pray lang ako ng pray kay God. Mahirap kasi mga hospital ngayon Pero I know that our God is a good God. He will not allow bad things to happen. Just pray. Just trust and pray. Lupus is a very hard-headed disease. Sometimes, okay ang feeling mo. The other day, hindi na. Minsan, magigising na lang ako, nahirapan akong tumayo, nahirapan akong maglakad. Minsan naman, naiinis ka ng walang dahilan. Minsan naman, saya-saya ng feeling mo. It also affects your mood. Minsan, magigising ako, sobrang sakit ng mga paa ko dahil sa pulikat. Talagang naiiyak ka sa sobrang sakit ng mga dahil sa sobrang sakit ng pagkakapulikat niya. Ang hirap talaga. I just hope and pray na makayanan ko pang labanan to. Bahala na sa akin si Lord. I leave everything to Him. What important is that I'm still alive. There is a saying nga na, every gising is a blessing. So when you wake up in the morning, give thanks to the Lord. That's it. So if you ever feel something na na-feel ko guys, pa-check na agad kayo. Early detection mas maganda. Para sa awareness and ideas. So I hope nakatulong sa inyo tong video ko for your awareness and ideas what lupus is. So yun lang guys. Thanks for watching. If you like this video, please like and subscribe. Thank you.